The threat by a resident Doctor Association of Zambia to down the tools because of the non-implementation of recruitment of volunteers. First and foremost, volunteers are not employees yet. And also when we are doing voluntary work, it's a personal decision. They are not forced by anybody, and there are quite many. This issue came up early this year. We sat here and we discussed and we gave the yardsticks and how to go about it. Very satisfying. It's amazing to find that they have rushed to go to the press instead of coming back here to see how far we've gone. We are dealing issues that concerns fiscal space. In other language, the treasury. You know Zambia, at the moment, the biggest issue we have at the moment is power. Power has overshadowed every other aspect. We had also an issue of maize, agriculture. We cannot ignore that, and your president cannot ignore that. These are priority number one. And nobody said it. No, this government is not employing. But these ones have become an emergency issue to deal with. We came here, we agreed. And if they saw that there was a delay, the best thing is to come back to the table to meet the minister who is willing to discuss and tell them how far we are. When we are saying recruiting this year, we depend on the finances available from the treasury. And the treasury gave us authority about 2 weeks ago. And when they give us that, there are stages. First of all, we have to deal with promotions, check within, and then later on, we have to consult the rest of the people. After all, it's about 2,000 to be employed. And within that, we had already agreed on what we should do with those who were already in the database. I don't know why rush to the press. Is it that they want to impress their members, that because they're engaging the government in that way? A doctor is an essential person. In Europe or in developed nations, you never hear of a doctor going on strike. You never hear of a pilot, the policeman, a soldier. These are essential people. How do you trust people can threaten to go strike when you're on the table being operated on? A doctor is supposed to be a very passionate person. It would be sad to see a doctor abandoning a patient because of the money. We are aware. And if we had enough money, we would recruit everybody. But just from a mission where my president sent me to lobby on the compact. He's trying to look elsewhere other than on our treasury, how we can resolve the issue. We have put infrastructure in place already. Equipment we are putting, but we need a human capital employed into it. We need every Zambian to be sympathetic and understand that this government is not idle. And also to my colleagues who are volunteering. We appreciate them and we thank them. But now, even before they're employed, they are swayed with the strikes. How do we trust them? How do we trust such a person? We need loyal people, trusted people as we move. Here, I'm urging them to come back to the table to see how far we have gone. In government, there are bureaucracies, but they are good because we go stage by stage. Even if we don't recruit them this December, it will still be recruitment for 2025. The money is under 2025 budget. We need people who are caring for the Zambian people, first and foremost. They are trained to care for lives of people. In terms of money, yes. In terms of employment, yes. If everything is made equal. Why not? Why not? It's our desire. It's my desire. It's desire for your president. The president is even more concerned. He's looking around to see what can be done. He doesn't want to see a mother die at birth giving. That's why he has instructed that there should be maternity annexes, there should be water, there should be electricity. All this is to improve the welfare of the medical personnel. We want to look into promotions out of what we have been given, and next year they will give us, but we have means and ways separate from this, which is trying to do. This president is a very caring president. We should not resort to tug of war. It doesn't mean when you are in association, yours is to go into a tug of war to fight. We are leaders who have to fight. They fought already. We came here, we discussed and agreed on the way forward. What else? We should not go to the streets. We should not go to the public. First come and then declare a dispute. At the moment, there's no dispute. There is no dispute. It's not about appeasement of the members. This government is very positive in the little space of the 2000. We knows, and even on the replacement, what action we have taken and what should be done. That is on that. I need also to hint on the other issues that concern procurement at Zamsa, where I'm being quoted by some newspapers that have directed that 73% should be given to mission farmer to procure health kit. I want to clarify the point. You journalists, you should be clarifying before. There was an advert by Zamsa that out of the 55 packages, 25 should go to mission farmer because they are experts and they deliver, they are always on time. The rest, other 25% or 25 packs should go to other new participants. But you see, there is a board. Even if there was no board, my office remained as a board and as a minister. We need to review that. There was a technical decision here made by PSC Technical, HMP. Said, no, let's not take things to chance. You know what happened to Honeybee? That issue. We cannot take to chance. This is a medical aspect. There could be failures. We have seen people have taken tenders and they have failed to supply. And when they fail to supply, we shall be in trouble. But the results have already demonstrated. Let's do it gradually. Instead of giving 25, first of all, mission farmer who have been doing 100% should come to almost 75 or 70 first, and then we see the new entrants, how they perform. If they perform well, we keep on increasing so that now it can be free for all to participate, which we thought was a good decision. They are saying Zamsa should be autonomous. It's not autonomous. Zamsa is an agency of Ministry of Health. And I'm the minister here. They want completely to do whatever they want to do without us having a hand. That's why we have been having problems there. We're having problems because they've been doing wrong things. Using the act. No, we are protected here. We are doing this. We have to offer an advice. And advice was written by PS advising them. Let's not lose stance. Let's use the expertise. The time when mission farmer has been supplying the kit, it is on time, good quality, good price. You can't chance it with newcomers. There is room for the newcomers. Let them participate. There is even a closed door, some for Zambians to participate within this allocation. I don't know where the problem is. They want us to be the ministers and permanent secretaries, see things happening without our input. How do you run that? There's management, there's consultations, and we need to advise and put in corrective measures. Secondly, the way they were packaging, they package for whoever or whichever center without regard to the demand. And as such, some of these kits are untouched in most areas. They are just expiring because they have no use for them. We have given directives that that should be redone so that the packaging is according to population and demand. For instance, in Rapula, malaria drugs should be higher than in areas like Lusaka. But Lusaka has got bigger population. It was also on demands, like things like ARVs and what have you. Depending on the trends and the demand, we should not just give anyhow. That is a wasteful expenditure. We are wasting resources. We need to be mindful. If it is demanded, we supply according to the demand. We are supposed to be analyzing the information and give accordingly. But whenever you give advice, they are feeling being interfered with. Interfered by what? Where are we in these offices? They need to be supervised. The problem is they don't want to be supervised. They want to be doing wrong things. Nothing has gone wrong. There was an advice, a correct advice to be done. So all those who are claiming that I directed, it was done technically and also to fit in and also reduce from 100 to some numbers as we go on to see the capacity building. I wanted this one to be clarified very importantly. Thank you.
Then, Minister, maybe also give us an update on the cholera cases.
She said the other issues.
Yes.
That they stepped down what will the government do.
Yes, yes.
But these are volunteers. Can you control a volunteer? A volunteer can agree to come for work today. He can stay away. You have no contractual binding agreements. He's not your employee. He's just somebody who's offering you a service. We have employees already in the hospitals, except maybe they are not adequate. But we thank all those who are volunteering. But it's not a condition that when you volunteer, you have to be employed. There are those who have been waiting for a longer time than others. So we are doing it systematically so that we address these issues. With more money, we shall employ more. Military personnel, well, we haven't reached that stage. But we have got Minasoko, we have got military institutions, they provide. And also they help even the general public. Wherever there is a military establishment, they are there, health facilities, they also attend to the general public. Indirectly, they're already doing us the service.
So maybe a word to the association. What word do you have to the association concerning their
concerns, our concerns. We haven't lost it all. We had agreed on parameters that should be achieved. They're supposed to come back here to check. And if there was something they were not too happy, then they would have declared a dispute. At the moment, there's no dispute. Then they want to appease the members of the public and their members that they are working. It's in the wrong direction. We have said no, they gave us conditions, and those conditions, we have done them, except we are just implementing them. We are waiting for financing. It's a wrong decision altogether. It's a bad trend. We don't take it that way. Government is willing, and we had agreed. They should not bring politics in these issues. We are more concerned even than the association itself. We are more concerned. The president is more concerned. If we had more money, that's why encouraging manufacturing, encouraging the economy to grow. When it grows, we have more money, we employ more people. Look at the ambulances. Look at what is happening in the health sector. And even the budgetary allocation. Well, this is meant to address problems. It was not happening during PF time. It never happened. And they never went on strike. But why now? Why do they want to down tools when we have started recruiting in masses? Over 20 people, 20,000. That's when you want to come and bring negativity to this government that is doing, which has done so much for the people of Zambia. You have to be careful. We have to be passionate about our people. We have to be passionate, especially the career in which we are. And the public has to be careful. Let's have our medical personnel that care for you. Not those who can down tools anytime. They will leave you in the theater. Let's have those who have got love for work, love to serve mankind, the last mile, who can save the lives of people. There are many of them. Like enough, this government has trained so much, and we're trying to do all the best. So far, it has demonstrated very well, and we should say, thank you, President Akainde Chilem. Thank you, God, you gave us a calendar to resolve some of these issues. These are touching issues: education, health, agriculture, and now we are talking about energy. These are difficult areas, and they complement each other. Very, very serious. You can't ignore any of them. Charity begins before you're employed. You start going on strike. You can agree? No, you're doing yourself a disservice.
That's all. That's all.
Thank you very much.
Yes, so an update just on the cholera cases. Any new
I
updates?
gave you, was it on last? We were there. We were in the hall the other day.